My name is Sabrina Fabi, and I'm here with someone who needs no introduction, Richard Fitzpatrick.
Hi.
And essentially today we're going to be discussing laser-assisted drug delivery, which I think and Fitz believes is really the future of laser surgery. And so what we're doing on this patient who's a Fitzpatrick skin type 4 and has a little bit of melasma and has had treatments in the past with IPLs as well as the 1927 nanometer laser is using the new Permea treatment for her. And it essentially is creating these little microscopic pores that allow us to drive some of our topical lightening products into her skin. And so Fitz has been essentially using the Alma impactor to drive that product and help it really penetrate even more. So Fitz, if you can kind of talk a little bit about that. Essentially what we do here in the practice is I would finish off treatment with the Permea, which is also a 1927 nanometer diode laser, and then Fitz, if you can demonstrate how you...
So for any patient with pigment problems, whether we're doing fractional CO2, fractional 1927, or 1550, or if we're intentionally treating melasma or PIH, I will use retin-A, hydroquinone, and clobetasol.
All three of them?
All three of them.
Why not?
One.
The more the merrier.
One after another.
And so here I am, and although I'm not using one of your favorite topicals in your fabulous combination, I am using a non-hydroquinone lightening agent called Lightera, which I like to use after these clear and brilliant treatments, specifically with the Permea. And I know you like to drive it in with the impactor. Hopefully we'll have a study soon showing whether this device actually drives it in more than mechanical.
Yeah, well, I think some people rely on capillary action of the little channels to pull it in, and just breaking the stratum corneum with a laser and rubbing it in. But we have demonstrated with some other particles that we can get large particles as deep as 800 nanometers. So I think this does significantly enhance absorption, and especially if you have some open channels.
And so you essentially do the treatment 4.5 minutes on each side of the face?
About 2 minutes on each side of the face.
And you see no problems or complications doing that?
I haven't had any,
And so although I'm doing the more or less aggressive form of Fitz's mixed master combination, I know I'm doing it with the 1927 nanometer diode laser followed by a 9-hydroquinone product like Lightera, or even your CNE ferulic. Fitzpatrick, you're using... Yeah,
I've used...
the Fraxel repair even.
I've used a combination of ActiveFX, Q-switch alexandrite, and then Fraxel repair.
And so I know...
I have a...
So I'll take this from you.
I put some Bellatero into my arm after a
fractionated CO2 treatment.
Fractional CO2, and this was about a month ago.
And how deep did you go with your CO2? You were at about
300 microns.
300 microns, and what density was your treatment?
I think I did 10%.
10%. And then you immediately did a topical Bellatero with the impactor to drive it in. About 10 minutes with the impactor? Or?
No, on this, because of the size, I did it for about 2.
Wonderful. And so I think that this is where we're going with the future of laser technology, laser-assisted delivery, and thank you. So to learn more about laser-assisted drug delivery and everything else that's cutting edge in laser surgery, make sure to come to this year's annual meeting in Phoenix. Thank you.